it's a great experience. If I was working as a GP, I won't really have an idea on how vaccines are being produced, how trials are being done. It's something adventurous, I would say. Like, you're looking for something new, right? You're looking for a new treatment, new technology. It's more adventurous.
Welcome to Business of Inclusion, a podcast by TRIAC. Who's TRIAC? We're the Toronto Region Immigrant Employment Council. What does that mean? We work to champion the skills and talents of newcomers and build immigrant-inclusive workplaces, because we believe when immigrants prosper, the region prospers. On the pod, we'll bring you topics that affect the region's employers and its increasingly diverse workforce.
Hi podcast listeners, I'm Jenny Okonkwo and I'll be your host for this episode of Business of Inclusion. Today, our guest is Flora Chungong-Choh, an international medical graduate, clinical researcher and blogger. Flora attended medical school in Nigeria, where she practiced for 3 years as a general practitioner before immigrating to Canada. Today, she's completing postgraduate work that includes clinical research at Sick Kids Hospital in Toronto. Welcome to our virtual studio, Flora. Thanks for taking the time out to speak to us.
I'm happy to join you guys today.
I can't think of a more timely person to be speaking to in the midst of the COVID-19 pandemic. There's been a lot of discussion in Canada about a possible role for internationally trained healthcare professionals, including international medical graduates like yourself. What's your take?
First of all, I will say thank you, at least the government, for thinking about us during this pandemic. It was a great thought. And likewise, they were thinking this was going to be overwhelming for the healthcare system. So thinking about us to come in to assist was a great idea. What they were saying with regard to the job description, or what they want, if the government could have made like a system where they connect you with a hospital or a healthcare professional, or they say a portal where you can register for that directly to meet with the hospital or with the doctor to assist them, that would be better. But when I looked into the program or what they were trying to do, I think they were saying they wanted them to go into most of the nursing homes to work there as caregivers, because most of those nurses or the caregivers at the nursing home, they're already overwhelmed. So some of them already participated in assisting this healthcare worker, which is a good idea, because what is still at the end is to help people.
That's been really insightful to understand a little bit more about engaging internationally trained medical graduates and healthcare professionals, what it entailed. Is it frustrating at any level not to be able to practice?
Yes, definitely. I would say yes. It's actually frustrating, like, especially when I just got in here, because before I came to Canada, maybe it was like 2 months before I moved into Canada, I was still working as a GP, right, before I moved in here. But when I came here and everything was just like a transition, you can't, like, there was no shortcut to get into the healthcare except there's not, even just to go and watch a physician here, what they are doing, at least, because medicine is practice. Once you stay out of practice for a long time, you start losing some of those skills. So you need to be in the environment where you see things happening, where you see how they are talking to patients, taking history, how they're making diagnoses, refreshing your knowledge, how samples are being collected. You have to be in the system. Let me put that in general. So when I came here, but there was no shortcut. You can only get into the system or step your feet into the hospital here if you do any healthcare related program or you write your license exam. So I would say it was actually challenging, but with the path I took, I think I'm in the right path so far, and I'm happy for myself.
That's fantastic. In terms of what you're currently doing in the field of clinical research, do you feel fulfilled in that space? Clearly you were working as a general practitioner back in Africa. So how does making that pivot to clinical research, how has that pivoting experience been for you?
Yeah, I would say clinical research is like another opportunity for me, like a great opportunity for me, because in working as a general practitioner, you see patients every day, you treat them. Most of them, some of the treatments, there's not really like a definitive treatment for chronic conditions or even cancers. So doing my postgraduate now in clinical research, there are a lot of things I've understood, like we need new evidence-based form of medicine, where more research happening, even with the with diagnostic equipment. Sometimes they give us false positive or false negative thoughts. A patient might come in with things like malaria. We used to have all these rapid diagnostic tests. We do the test for this patient, and then maybe it's negative, and then you as a doctor, you're thinking, what else could have been causing this fever or whatever the patient is coming down with. Meanwhile, maybe it was just the diagnostic equipment that wasn't right. So it makes the management of this patient difficult. And then maybe later on, by the time I want to discover what is actually wrong with this patient, the patient is already at the late stage, making him maybe at the end dying or making it more difficult for these patients. So clinical research basically means the world needs a lot of research. It's a great experience. If I was working as a GP, I won't really have an idea on how vaccines are being produced, how trials are being done, how you recruit patients. It's something adventurous, I would say. Like, you're looking for something new, right? You're looking for a new treatment, new technology. It's more adventurous.
It's certainly insightful, Flora, that window you have given us into your thought process on how a program in clinical research can help build knowledge and expertise in the areas you mentioned, which of course will strengthen your skill set for the future. I understand firsthand some of your experiences as an immigrant myself and coming from a regulated profession. Having arrived in Canada as an internationally trained accountant, there were steps I needed to take to adapt to a new environment. While I was re-entering the same profession, a major part of my journey at the beginning was developing networking skills and becoming a Canadian CPA. At a later stage in my journey, and based on my own newcomer experiences, I launched Black Female Accountants Network, also known as BFAN, a member of the TRIAC Professional Immigrant Networks program, also known as PINS. From our previous conversation, Flora, you explained to me how you went about selecting your particular program, in particular how you selected the course provider through the use of social media platforms and certain techniques you used to help you make that final decision. It's a fascinating story. For the benefit of our audience, could you please walk us through the steps that you took?
Yeah, so when I moved to Canada, first, my intention was I wanted to do a master's in public health. That's another part of medicine that I'm very interested in. So that was actually my plan, to do a master's in public health. I applied in 3 universities. Yeah, 3. I think it was only one that took me, but by the time they gave me that admission, I already started my clinical research program. And the program they gave me was not actually what I wanted. I think it was in global health. So I went into LinkedIn doing a research on other international medical graduates, maybe what they do when they come here, what other programs someone can switch into. So when I looked into, and I came across this clinical research program, as most of them were clinical research coordinators working in the hospital. So I checked which universities offer the program here in Toronto. So I checked, I noticed McMaster does it, but yes, and Humber College, they do the program, but it was online. And then I also came across Oxford College in Scarborough. But usually I prefer the on-campus kind of learning as compared to the online. So when Oxford gave me admission, I was like, Oxford College, even though I don't really know much about Oxford here in Toronto. So I still went back to LinkedIn and I checked most of the profiles of these healthcare professionals that were into this program, and they're doing so well, working in all these big pharmaceutical companies and in the hospitals. Most of them graduated from Oxford College. I didn't got to speak to a couple of them on LinkedIn, like, what do they think about the program in Oxford and the learning environment? They said they were like, no, the program is a good program, and everything was okay, that I should have no fear, that I should just go ahead and do the program there. So that's how, together with my husband was also very supportive. He was always doing this together, looking for what next. He was always there. So we went there together to Oxford. So we did everything with regard to the admission process, and that's how I went into the program. And then that's when my journey started in clinical research. And it has been a great experience so far.
Yeah. That is fantastic, Flora.
Yeah.
I find that story so inspiring, because it just brings in so many things. It brings in how important having support is, so the fact that you said, your husband was helping you with the research techniques, and also, helping you with that self-belief, like you were saying, it's such a journey, and sometimes you can doubt yourself. So having people that believe in you is so critical in this immigrant professional journey, which was one of the key things I took from your story. That proactivity and taking that initiative to jump on LinkedIn. So here's an education services provider that you'd never heard of. So you'd heard of all the others, they're fairly widely known. Here's one that you hadn't heard of. And rather than just maybe dismiss it out of hand, but to take that initiative to jump on LinkedIn, and this is where LinkedIn really comes into its own, jumping onto LinkedIn, checking out the college, checking out people who had gone to that college by examining their profiles and then getting in touch with them, getting that inside information and insights as to the program, seeing what jobs they'd got on to do, their career pathways. I mean, that is just a phenomenal amount of initiative for a newcomer to take. And leading on from that, Flora, in terms of the employers that you met, who are obviously, in charge of recruiting professionals, internationally educated professionals, so handling that whole recruitment process, how were you able to, I guess, convey to them, the value and the contributions that you could bring as an internationally trained medical professional, healthcare professional? Like what were the examples that you gave them in terms of, your experience, your contributions, the value that you bring?
Usually they were asking me maybe like something challenging, maybe working as a doctor back in Africa or in Nigeria. Yeah, so I had a couple of examples. I was like, first of all, the healthcare system in Africa is not developed like the one in the West, like in Canada. You're not really thinking as a doctor to look for what is wrong with this patient. You're thinking of where do you have to get gloves, where do you have to get saline, where do you have to, you tend to borrow everything, or even go use some of the things from your pocket just to save most of these patients. Then also in the interviews, you give your examples. Like I gave examples of other things that you're able to handle. Maybe you were on call alone as a doctor, and a difficult patient came. How were you able to handle it by yourself? Things like that. So I gave example. Maybe there was a time I was working at emergency, and this woman came in. She was pregnant, and she had a road traffic accident, and she was brought to emergency. By the time they brought this woman, she was dead, and her pregnancy was almost, I think, was like 38 weeks already. So the husband rushed her to the hospital. By the time I checked her, I was on call that night. By the time I checked her, she was already gone. So we said, but let's check. I quickly checked the fetus, the heartbeat of the fetus. We could still get the heartbeat of the fetus. So immediately on that spot, even without going to the theater, I just got the normal glove that's not even the sterile gloves that we use for if you want to do a CS or anything. So I had to call my assistant that was with me that night, let her come right away. She came in, she was with another patient, she had to come there. We cut that woman right away from there and brought this baby, and this baby was alive. And the husband was so grateful and really appreciated what we really did for her. So immediately we sent that baby to the intensive care unit for babies, and that baby made it at the end. Even though we lost the mother, but at least the husband and the family were very appreciative, very happy with what we were able to do that night. The examples like that.
These are amazing stories, Flora, and they particularly resonate at this time because they are life and death scenarios which you handled on a routine basis as a doctor in your own country. It's not surprising that these stories would have made quite an impact with the HR professionals responsible for recruiting and hiring healthcare staff that you met during your interview process, because they demonstrate the desired skills and attributes employers are constantly looking for in terms of the fact that you have the knowledge, expertise, tenacity and stamina to lead and problem solve in crisis situations. Based on your experiences to date, I've one more question to explore with you, and I'll use the following example. Let's say an international medical graduate messaged you on LinkedIn and said they were planning a move to Canada post-COVID-19. what would be your top 3 tips or pieces of advice that you would give them?
That's a good question. The license exams in Canada, I know they launched the exams in like over 60 or is it 60 countries in the world. Because before I came here, the exams you could write them when if you're a Canadian permanent resident, and then that means that you have to come to Canada and then you start navigating if you want to continue with your practice. But now, at least the Canadian health system made it better by launching these exams in 60 countries and more all over the world. So by the time you are coming here, you are sure that it won't take you longer like the system before, where you have to come here and struggle with the PRO, struggle with a lot of things, other jobs, to raise money because you have bills to pay as well, right? If not, or if you just want to come to Canada, I will tell you, okay, yes, but the truth is you won't come to Canada and get a healthcare job immediately until you try to fulfill the steps to get your license here. But likewise, I'll give my own case and an example. Like if you want to come here and do maybe a postgraduate program, either in public health, in clinical research, like what I did, that's another shortcut. Because when you do that, at least you can have the opportunity to work in the hospital like an intern. You create connections, meet other doctors, understand how the healthcare system here works. Something that will keep you close to patients. At least you always have that in practice. Learn how to talk to patients. And when you go for those OSCE exams, when you're writing the exam for your licensing here, I think with that experience, it will help you more. You'll be at a higher position for you to easily make it in these exams as compared to others. So I think that's what I would tell anybody that's an international medical graduate that wants to come here. Those are my options. Either you write the exams back from home and then you start applying for your PRO if you want to come here immediately. Those are the other alternatives that you start looking at before you come in here. So that's it. Yeah.
Thank you very much indeed for spending time talking to us today on this interview.
Thank you, Jenny.
It was very insightful speaking to Flora and, of course, particularly illuminating given the current state of healthcare both here in Canada and around the world. For the latest information about COVID-19, visit ontario.ca. Flora's personal blog is Flora Choh, FLORACHOH.com. I've been your host, Jenny Okonkwo. Today's episode was produced by Rohit Singh and Andrea Thompson. And that was Business of Inclusion. You can tell us what you thought about this episode and what you want to hear from us next on Twitter at TRIEC, TRIEC, or on LinkedIn at Toronto Region Immigrant Employment Council. Thanks for listening.